Okay. So, hi, morning, friends. Morning, everybody, bache. I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MMC, MD Pathology, Resident Hemato-Oncology, AIMS Delhi. And we have Madhu with us from God's own country, that is Kerala, with an awesome rank of 213 in this NEET MDS 2024 exam. Firstly, heartiest congratulations, Madhu, for this great rank.
Thank you, sir. Thank you so much.
And please do share your journey with us, with our juniors and everybody.
Sir, actually, I completed my internship around October 2022.
Okay.
So, actually, I didn't prepare much during my internship time, actually. So, like with 4 months, I had my first attempt, I guess. So, I gave my first attempt around March. Uh,
Okay. Last year,
so,
March 2023.
yes, sir,
Okay.
2023.
Hmm.
So after that, I got around 1,500. So like I decided I will give one more attempt.
I'll slightly interrupt you here, Madhu, because morning also I took interview of Sohini, that is rank 92, and this time, and she also had a rank of about 1400 in last attempt. So I want to know this thought process because 1400, 1500, these are actually very decent ranks. At these ranks, I mean, majority of the students will pick up. So you dropped and succeeded. So, what was your thought process while dropping? Were you certain that you will be able to do it? Were you uncertain? You had doubts? What was it?
So, sir, I definitely had my doubts. My mind was pretty skeptical. I was like, I was weighing the pros and cons actually.
Hmm.
So because if I don't get into today, I would have been really disappointed because I would have felt like I wasted an year, right?
True.
So like I had some good friends and some seniors who told like if you are willing to take the risk, you should uh, take.
Taking risks sometimes they help, and it is about being all in. Did you, in this drop year, did you join some clinic or were you full time into the study mode only?
No, sir, I was full time into studies.
You so actually, this is for all the juniors as well as the students who could not score that well this time. Majority of the toppers that at least are conversing with me, what we are seeing is that they are studying full time. So, pick as such, the number of seats in the MDS government segment are less. So, if we want to get a top rank, we have to be fully committed. So, tell us about your preparation strategy, Madhu. Which subjects you found tougher, easier?
So then I joined around April. By April only I joined the DBMCI. So like my so back at college, no, my medical subjects were very weak. So I have to be very honest. I didn't have any idea going into medical subjects. So like I was weak in pharmac. Then medicine, patho, micro. I had no idea, sir, patho and micro. I
Okay.
personally, I didn't study that. Both the subjects I didn't study. I just went ahead and but after your classes I understood that it's not at all a dry subject, it's just that it's not taught in
Yeah,
the right
yeah,
way.
actually, sweet to say.
So
So, medical so another thing that is common between, I'm saying that for the juniors as well as the students, is dental subjects. Majority of the students are comfortable up to a level.
yes sir.
It is the medical subjects which increase the rank or which get you into the top positions. Which subjects gave you the maximum problems that you had to revise them the most?
So I guess this pharmacology, medicine, these were the
Okay.
main problems, sir, because the weightage with these subjects are like very high, and
Okay.
that too like the questions are not like they don't the number of one liners are decreasing with every
Hmm.
year. It's really concept based, so without knowing the depth of the concept, no, it's pretty difficult having giving like some board times. I felt that last even first attempt we had three chest x-ray questions
Oh,
and
yeah.
all. Uh,
Okay. So it is studying from the subject specialist. It is
yes,
not that anybody can come teach you a subject and go. No, it is about studying from national level faculties, from
yes,
specialists who have cracked the papers, who have given the paper, and they know that this is what is asked.
Yes, sir.
What about dental? What about dental, Madhu?
So dental also, like I guess the especially the first and second year subjects, no, I was weak in that, with especially with dental materials. It's it's a very difficult subject, sir,
It is a factual. It's
and I was
slightly
very bad at it, sir. But
okay.
I'd say then Aishwarya sir was a
Okay.
faculty with dental material, so he made sure that no, he stressed upon all the factual things again and again and again. So like
Mhm.
I was after completing the regular classes, there was his T&D and then his final lab. So he made sure that he stressed on the important topics. So so by the end of all this, no, dental materials actually became a relatively easier subject. It wasn't
So
that difficult.
in DBMCI, you took everything. You
Yes,
started with the full course, live full
yes,
course, if I'm not wrong. Then
yes,
you went on to the crash course part, followed by the TND.
yes, sir.
Tested it. So it was the complete package. So you revise everything thrice minimum, the full
Yeah.
course, the crash course, TND, and then you go and give the paper. Perfect, Madhu. So if you have to say three secrets to your success for the juniors that follow this, and you will be giving the interview in my place next time, what will you attribute it to?
So I feel that you have to be consistent along this preparation, because there were many moments where I felt that this was I honestly am saying that I felt I should stop this, I should give this up, because
Consistency. Did you feel like giving up? I mean, because you had a good rank last time. Before the result, were you having any regrets, any doubts on yourself? Ki shit, what have I done? I should
yes,
have
sir. To
picked.
be very frank, I had because in the first place I didn't expect a decent rank, so it felt like I was doubting myself whether this was out of sheer luck or
Luck
uh,
favors the brave always, Madhu. Matlab, don't
so
worry.
like throughout the process I definitely did have my doubts, but then I had good mentorship with Dr. Ashik back at Calicut. So I used to share, we had such open conversations, sir. I used to tell him like okay, it's really getting tough. So he was always with me, he was like no, you have to, you don't look at the GT scores, just move forward. So like because I mean, like, I owe him a lot.
Dr.
So
Actually, Kerala Center, Dr. Ashik, he is in very close contact with students,
yes.
and he is doing an excellent job. No doubt about it. Absolutely.
So like say does we will always doubt ourselves, because I don't know why, but I always had my doubts, but somehow with good friends and mentorship I continued till the very end. So I'm glad that I continued now thinking back.
Okay, so
So like
consistency.
yes,
Next,
second,
next. Hmm.
next would be, so see, it doesn't matter that if you have done the subject prior now, that it doesn't matter, you have to always keep on revising, because the simple things, no, we will forget if we aren't revising it. Like if from patho view, if I can say that when your class ended, I was very clear between the difference between for example apoptosis and necrosis. But by the end of this course now, if I hadn't revised, I would be like, I just know those words, I don't know
So
what
how
else.
many revisions would you consider as ideal? If you have done it this time,
So I would say that yeah, well, at least 3 times I would have done, sir.
perfect. So, and that is personally, I'll also say that that is a good ideal number. So, 2 to 3 good revisions without leaving any subject. Do all 19 subjects, 2 to 3
Yes.
good revisions. Follow it up with crash course, test and discussion, and the success shall be yours. So consistency, revisions. And what about giving tests, subject-wise tests? Did you do MCQs side by side? What was your
Yes,
strategy?
sir. Yes, sir. See, sir, our classes would be mostly on alternate days from 5:30 onwards. So that from that till night, I used to attend the live classes, make the notes simultaneously. Make sure that we write proper notes. We shouldn't compromise on our notes at all, because we can't go back to our textbooks or anything in the end. Um, our notes should be very concise and should be properly made. So like initially giving GTs, no, like I think GT1 started around June or July. So only half of the syllabus was complete by that time. So I was very skeptical, should I attend or not? And then again, Ashik sir always said, you shouldn't like look at the ranks at all. Just
Yes.
continue. Now looking back, I can say that, sir, my GP scores weren't that great. I have to be. It was always around like 600 marks I had. So so you can understand now why I have my doubts, because
No, no, but
uh,
the thing is ki you kept on giving grand tests. See, in
yes,
the
sir.
only one test matters, and that is the actual paper. So you had enough experience with grand tests, mock
Yes, sir.
tests. Your score was increasing probably with every paper. So
Uh,
that is the path to success.
yes, sir. So, like, I think we should give grant test from early on. We shouldn't look at the marks. Let's just attend the paper, have a contact with the questions.
Have a feel of the paper. This
Yeah.
is what it will feel like. Because sitting for 3.5 hours continuously in the paper is also not going to be easy, I guess, if we have not done it many times.
So,
And
like, uh, so
another
I
thing,
like.
Madhu, that
Uh,
you actually said was make your own handwritten notes. I mean,
yes.
I loved that part also. And this is what majority of the toppers are saying. Until and unless you don't write with your own hands, the recall is slightly on the lower side.
Yes, sir.
True. And lastly, Bache, anybody you want to thank, parents, faculties, Ashik sir, anybody, I mean,
Sir,
last statement.
so DBMC has been more like a family. Sir. Like I have to take, like
Yes, yes,
I have
yes.
been in touch with like Dr. Srishti with our pathology. She has I have reached out to her when I got really stressful. So
Okay.
in fact she even called me at times, no, to check whether
Okay.
I was doing good.
She is actually a good friend, great mentor. I mean, no
Uh,
doubt. Okay.
and Dr. Himani ma'am, who used to we used to have mentorship at every morning. We used to have mentorship sessions,
Okay.
and Bate Calicut in general, they were like super supportive.
They
So
are, I mean, yes, yes. And of course, the parents, the family
yes,
who supported you. I mean, without their support, I guess we'll be nowhere.
yes,
But done, Madhu, absolutely done. And again, congratulations. And let the results sink in. Take a deep breath. And Asha, one last question before I wrap up the interview. Are you planning to give INI exam?
yes, sir. I'm thinking. Like, I was
So are you
relaxing.
going to study for it? Yes, slightly relaxed that I have a great seat in my hand and
I am trying to pick up the motivation to study, sir.
but it is slightly on the lower side at
Yes, sir.
present.
Yes, sir. Sorry.
I know, doesn't matter. But so actually, this I asked that question purposefully. I am saying this for the viewers and for the juniors or somebody who did not have that good a rank this time. But yeah, the toppers will be slightly less motivated to study at present. I mean, bluntly said. But if you cope up, if you study harder, just for these 2 3 months, INI seat is just around them. So
Yes,
on this positive note, take care, Madhu. Take care,
thank
Vachi, and
you.
it was great
Thank you.
interacting with you. Thank you.
Thank you.